Going straight in, I reckon you're missing out probably on a quarter. So 25, I reckon 25 to 40% of the booked appointments you could have gone. So let's say you had 100 consultations. You're missing around 25 to 30 of those consultations that might have not become booked appointments for them to then become booked appointments, right? Because in average, in the industry, right, it's around 60 to 80% that good dentists have conversion rates. That's good dentists, not all dentists. And by good dentists, I don't mean, in their dental skills, more so in their skills to be able to convince those patients or, have good sales skills. So if, let's say, you're on the lower end, you need to make sure you have a way of getting those quote unquote lost patients, right? Lost potential patients back into your office. And the best way to do this is by simply calling them up. So let's say someone had a consultation with you on week 1, right? Week 1, it was a Tuesday. They had a consultation with you. For some reason, it fell through the cracks. You weren't able to get them to book an appointment. And then in week 2, Monday, you decide to call them and you say, I'm just going to go with the name John as usual. Hey, John, I'm just calling you up because last week we had a consultation and you said you weren't too sure about going forward with the treatment. How are your teeth feeling, by the way? Just, in case John is having toothache or anything like that. Obviously, go with any sort of symptoms or anything they mention in the consultation itself. But you kind of just want to reel the conversation back into the problem that they're having. And at the end, you offer them the solution, obviously. And again, the whole point of this is to kind of make it really conversational. So don't go in expecting it to go one way. Don't go in just thinking, I need to get them back in, Just have a conversation with them. Understand again, right? Because on Tuesday, you might have had the wrong mindset. Understand again if this is the right thing for them. And then once you finish having that conversation, you can say, okay, John, that's absolutely amazing. From the sounds of it, like I mentioned on Tuesday, you could really do with the treatment. Do you want me to book you in for this Friday, John? Just because, my calendar's getting pretty booked up and I want to get you as soon as possible. Then obviously John will say whatever he has to say. Whether it's an objection, I will just give an example now. It could be, yeah, I've been thinking about it and I'm not too sure, to be honest. I don't know. I don't know, to be honest. The I don't know or the stuff that they're confused about, right? It's usually an I don't know, or they basically don't show a lot of confidence in the fact that going with the treatment would be beneficial for them. So you ask directly and you kind of want to say it. And this is the most important thing. When you say these things, you want to say them in a way where it's not shocking. Because if you sound shocked, if you sound taken aback, if you sound like, John is doing the wrong thing, then his barrier is going to go up. He's going to protect his ego and he's not going to want to do anything else. He's just going to want to leave the call. So you say to John, all right, John, that is absolutely fair. I mean, is there anything in particular that you're confused about, or you can be honest with me? Is there anything that you don't like about the treatment? And then John will give you the actual objection he has. It could be that he's found it too expensive, and that's why on Tuesday he walked out. And then you can offer him any sort of financial plans your practice has, etc. Or John might just say, I'm still a little confused on what this actually does for me. And then dentist hat on, or in this case, I guess it would be mask. Dentist mask on, tools out. You explain to John what the treatment actually does and how him being in the painful situation that he currently is in, how we will solve all those problems. And even if the treatment prescribed isn't solving all of them, you can mention that he can do another treatment for another thing as well afterwards. Obviously, because some treatments are in steps. Treatment plan, sorry. But that's the main thing. And that's the thing that's going to move the needle for you getting those lost booked appointments, those lost consultations, into your diary again. Because not only does it give you a second chance, right? But after a certain amount of time, after a certain amount of time you see these people, they're just going to go through with it, right? They're not going to be annoyed, because if you look at it this way, if I kept getting a call from my doctor saying, Fedi, I want you to come back in, I want to do the scan again with you, I just want to keep showing you, you've got an issue with your arm, let's say, for example, you've got an issue with your shoulder tendon, I want to help you out, are you okay to come in for next Tuesday, blah, blah, blah. From my perspective, so from the perspective of the person you're calling, so from John's perspective, you're helping him out. And that's true, because it's your moral duty, it's your job to help these people out. But he's not going to be bothered by it necessarily. Unless he obviously sets the boundary and he says, stop calling me, then don't call John again. But you get the point. The way to move things forward in a scenario where you have patients coming in, but not enough to fully book yourself, you need to kind of go back to not old patients, but old potential patients that were lost and try and get them back in. The reason that you might not be able to do this is that you don't have a phone in your office. That's it. That's the only excuse I can think of. If there's any other one, I'm going to be real with you, it's a cope. You're just trying to cope with not picking up the phone and calling someone. But at the end of the day, from one of the dentists I spoke to yesterday, he mentioned that he would love to do it. Now, he would love the opportunity to understand more about why people leave the chair, why people leave the office, right, before going forward with the treatment. And that gives you the opportunity to kind of explore a little bit your mistakes. So if I recap point one, it's that every missed opportunity, every lost patient, you get a second try to get them into the office, you get a second try to get them to the treatment, second try to get them to book an appointment. Also, and I think this is, to be honest, the more important one, is that you kind of realize the mistakes you made in the previous consultation. So I'm just going to say, for example, with John, I didn't have much conviction in what I was saying to John. So he didn't really trust my word that this treatment would work. I kind of spoke, I might have been a bit tired, just saying, yeah, John, I mean, it worked fantastic for you, to be honest. You were telling me you've got a toothache around the molar. That's absolutely fine. We can get that sorted. I mean, you can tell by my voice, I don't have much confidence that this is going to get sorted for John, and John will sense that. So when I have the second call with him, he might admit to that. Or when he hears me be more confident, and I notice it, then I'll know that I made a mistake in the previous consultation, which was me not being confident. Or I might have looked back at it, I might have looked back over my bookings and everything on my laptop, and I would have seen, John didn't book again. Yeah, I must have messed up that consultation. What did I do this time that didn't work? So now you've learned. You've learned from your mistakes. You're going to have the opportunity to call them again. Think about how many people you can get back into the practice, right? Just because you're able to call them after they didn't either come into the consultation or after they didn't go forward with the treatment during the consultation. I'm just saying, just think about it, because I don't know your stats and figures, obviously. I'm just saying, take a second during this video to just think about it. You can pause it now. How many people have you lost? How many people have you lost that you can potentially get back into your office? And think about it. If I mentioned the stat, right, which was, again, typical of decent dentists, and again, when I say decent dentists, I don't mean in the dental profession, I mean in the sales part of dentistry. Most of them have a 40 to 60% conversion rate. So on those 40 patients out of the hundreds, and you've done hundreds of consultations, I know you've done hundreds of consultations. In those 40 that you've missed, what you'd be able to do is get them back in, as I previously mentioned, but also hone in your skills, again, as I also mentioned. And most importantly, it just keeps you flowing. Because if you can get 10 of those, if we go by the normal conversion rates, so I'm going to stick to 50%, by the way, just it's easier. So if we go 50, and only 50 of those people that you called, only 25 of those people that you called actually come into the office, and then only 12 of those people that came into the office you got, as a booked appointment, as a treatment plan, that's 12 people that came from 50. I mean, sure, it's not amazing, but that's 12 people you didn't have coming in. That's 12 people that your marketing team didn't have to pay extra for. Or that's an extra 12 that you didn't have to meet again, as in start anew. So, to be honest, it's quite beneficial in every way possible to call the patients or the lost patients that you had and get them back into the office. Best case scenario, and I showed you the worst case. The worst case is 50, by the way. I mean, I know I said 40 to 60, but it was around 45, I think, or 47 or something like that. But in most cases, so worst case, you get 50. You get 12 of those 50 that you called through to a treatment plan. Most cases, you'll probably get 20, 25, right? And then best case scenario, all of them come back in. Best case, obviously, you're wishing there, wishing on a star, but Do you see my point of where this comes into the big picture of you being able to accomplish what you want to accomplish? Do you see why this comes in for you making more revenue? Do you see why this comes in for allowing you and your team to feel more comfortable in having consistent patient flow? Do you see how this works in you not having those weird empty gaps where you don't know what to do? And of course, you've got loads of work to do, but at the end of the day, what you love doing is sitting down in a chair and helping someone. Of course, there's the admin stuff, but what do you really love doing? Sitting down in a chair and helping someone. And this strategy just lets you do that. Thank you so much for watching. I didn't do my usual introduction just because, oh well. So if you watch my other videos, that's why it's missing from the start. But I just wanted to say, if sales training is something that is important to you, I'm not going to send you to a link in the description because I don't have it there, but I do offer free sales training to dentists, just that they can hop on a call with me once every 2 weeks or once every month. And as I mentioned, it's free for the time being, probably up until, I don't know when, but it's free for a while. So get in contact with me via email. That should be on my YouTube page. And you can get in contact with me on LinkedIn. Again, that's on my YouTube page. Just let me know. I'll be glad to help you out. I've helped out a few already, getting on calls with them every 2 weeks, every month. And it's working amazing, apparently. I mean, I can't share the information yet, NDA and all of that, but it's working really well. And honestly, I'd love to help you. If you're willing to listen to me in my charming voice, but I'd love to help you get more conversions, get more booked appointments, get more patients. At the end of the day, make more money. Whatever that means to you, I'll be glad to help. So thank you so much for watching. If you liked the video, just pop a thumbs up. Otherwise, if you didn't like it, pop a thumbs down. Honestly, it shows me what works and what doesn't. So as long as you voice your opinion, I don't mind at all. I'm not going to cry. But yeah, so subscribe if you want to see more videos similar to this. It's all about practice growth, really, if I could sum it up in 2 words. So leave a comment with anything else you want me to make video-wise, specific objections and everything like that. I do have something really cool coming out in a couple of weeks, so I will let you know when it is out, but it is big and you will love it if you are into the sales part of dentistry and especially improving your conversion rates. So thank you so much. I hope you have a lovely day. Hope you've learned something from this. If you haven't, rewatch it because I want you to, but you should. But yeah, thank you so much for watching. Take care.